George Emile, and today we'll be talking about gum issues, periodontal disease. We will start out by saying that periodontal disease affects about 60% of Americans above the age of 30. So it is a very common type of dental disease, and that's why I decided to start this show by talking about periodontal disease. We'll start with the definition of periodontal disease. Peri means around, dontium is the teeth. So it is an inflammation around the supporting structure which hold the teeth. It is very common is because it is a progressive disease. It continues as we get older, and other issues make it worse. Those issues are smoking, hygiene, how well you take care of your teeth, diet, and if you have any other systemic diseases like rheumatoid arthritis, diabetes. Periodontal disease starts out with a very simple form called gingivitis. A lot of us know what gingivitis is. Gingivitis is inflammation of the gums. And how do we know that we have gingivitis? Is that when we have bleeding gums, and when you brush your teeth and you see blood coming out on your toothbrush when you rinse, that is an inflammation of the gums called gingivitis. Untreated gingivitis becomes worse, and what you see is painful gums, and the prognosis of gingivitis is good because all you have to really do is to brush better and see your dentist. As things get worse, the inflammation of the gums becomes an inflammation of the bone that surrounds the teeth. This is now initial periodontitis, and that is dangerous. What we also have to concentrate on is how to brush. And why is brushing very important? Because that is what gets the plaque, the calculus, which is the bacteria, off the teeth. And we're going to show you how to properly brush and how to properly floss, because brushing is really important, and lack of it will cause damage and infections and will damage your teeth. So I'm going to show you the difference between proper and improper brushing and how to brush your teeth the right way. Flossing is very important because you also don't want to damage your gums, and improper flossing or not flossing very good can damage your gums. So we'll show you how to properly floss, how to brush your tongue to eliminate halitosis, which is bad breath, and using mouth rinse. So that will be discussed in the show today also. We're going to discuss electric toothbrushes and the benefit of electric toothbrushes as well. When it comes down to brushing your teeth with an electric toothbrush, you have to be able to use it as recommended and not overuse it. If you do not use an electric toothbrush correctly, you can cause what is called toothbrush abrasion or gum recessions. So you have to be careful how to use an electric toothbrush. And I will show you a few of them. Here's a couple of electric toothbrush, and there's many on the market that are promising different things. What you need to know about electric toothbrushes is that you have to be very careful how to use it, because if you overuse an electric toothbrush, you can damage your teeth, and you can cause gum recession and what is called toothbrush abrasions. And I'm going to speak a little bit about toothbrush abrasions. Describe to you what is toothbrush abrasion, I'm going to give you some scenarios. Patient comes to me and says, "Doc, every time I drink something cold, every time air gets in my mouth, it feels very sensitive. It lasts a few seconds and it goes away." I then check around the gums of the teeth to see if there is what is called abrasions. And those abrasions are caused by the recession and brushing too hard. I will show you what they look like. Abrasions are removal of the enamel of the tooth, and that is when you brush really hard, you remove the outer surface of the enamel, which is the protective layer of the enamel. It protects the dentin, and the dentin, which is underneath that, protects the pulp, and the pulp is what has the vitality of the tooth, which is the blood supply and the nerves. So when you brush really hard your teeth, you remove the enamel. The enamel is like the coat. So example, if you want to picture it, you are removing your coat and you're going outside to the cold. You'll feel everything. You feel the cold because you removed your jacket. So the enamel is like the jacket of the tooth. It covers the tooth and it protects it from the heat, the cold sensations. Healthy gums, healthy smile. And healthy smile and a healthy gum looks to us pink and firm. They don't bleed, and there's no sensitivity. And when you brush, you don't get this exudate coming out. So that is something to keep in mind. What I want to talk about first is a healthy smile. What is a healthy smile? Now, some of you just go to your doctor or your dentist and you lie and say, "You know what, Doc, I brush 3 times a day, I brush 5 times a day, I floss, and I do all that." But you know what? Don't try to cheat your dentist. He knows if you've been brushing or not. Okay? So be smart about it, and do brush your teeth and floss and use mouth rinse. It's really important, and it will make a difference to how long you will keep your teeth. There's an example that says, brush only the teeth that you want to keep. And but it's true. Okay? So we're trying to keep our teeth, and we're trying to keep a healthy oral environment that will prevent disease. Periodontal disease is classified as mild, moderate, or severe. And the mild, moderate, and severe have certain signs and symptoms that we can determine to see where we are into that disease. So it's very important that you don't let it advance to the more moderate to advanced stages, and it gets treated early. It is also classified as localized or generalized. Localized means it's one area or one tooth or 2 teeth, as opposed to generalized. Generalized means it is all over your mouth. That will also determine how we treat this disease. If periodontal disease is not treated, you will find that your teeth start to become loose and very painful. The looseness of teeth is an indication that periodontal disease is in an advanced stage, and that the bone that is holding your teeth has shrunk to the point where the teeth become loose. And the teeth are into the bone through the roots. And similar to if you have a tree, and the roots of the tree starts to be exposed due to the ground deteriorating, and the ground resembles the bone. So if the ground that is holding the roots start to resorb, the tree will fall, because the roots of the teeth are now not maintained by the ground. So periodontal disease is a serious condition. It is treatable and should be considered by all patients because it will affect the longevity of your teeth. Before we start any treatments on patients, before we start, most dentists, before they start any prosthetics treatments on the patients, like bridges and partials, they will need to make sure that the periodontium or your gums and bone are solid, because when you create a bridge or a partial, that puts stress on the remaining teeth, and if they're not solid enough to hold the partial or the bridge, they can fail. So it is very important that all dentists check the gums and make sure that they are solid and they can support bridges and all the great stuff that we do, partials and so on. So you will see that most of your treatments will start out with the periodontal treatment, whether it's scaling or deep scaling, or just go straight into the prosthetics if your gums are healthy. Treatment of periodontal disease is a multi-step way. First things that needs to be done is the patients need to be educated on what is periodontal disease, what is the cause of it, and how to slow it down, because periodontal disease is a progressive disease. We can slow it down, but we really can't stop it, much like osteoporosis or aging. So we need to educate the patients and what is really periodontal disease is, what it is. The treatment of periodontal disease requires the patient to come to the office and be treated for that disease. The first things we do with periodontal disease is what is called periodontal probing. Probing is the measurements of the pockets around each tooth to determine how much bone is lost around each single tooth. And by doing that, we can determine where on each tooth is the bone loss. Is it on one surface, 2 or 3 or 4 or 5, 6 surfaces? Once periodontal disease is diagnosed, the treatment will be to treat it. And the first thing to do after patient education is what is called deep scaling, or as we call it, SRPs, which stands for scaling and root planing. And people ask me, what is the difference between regular cleaning and SRPs, or deep scaling? The difference is very simple. Regular cleaning is mostly removal of plaque and calculus above the gum. All the portions that you see in the mouth above the gum is usually the regular cleaning. The deep cleaning, or scaling and root planing, involves removing plaque and calculus that sits under the gum, near or on the roots of the teeth. That area underneath the gum, beneath the surface, is not something that you as a patient can clean, because you can't see it and definitely you can't reach it. So what we do as dentists is we numb the patient or give them local anesthetic so they don't feel it, and with hand instruments and ultrasonic scalers we go in there and scrape away at this very hard structure called calculus to remove it off the tooth roots. Once the calculus has been removed off the tooth root, then we can apply some medications or antimicrobial medications to fight off any bacteria that was sitting into that area. The patient is then given oral hygiene instructions on how to maintain proper oral hygiene, and is usually followed up between 2 to 6 weeks. 2 to 6 weeks later, the patient comes back. We recheck the gums to evaluate any improvement that has taken place after the plaque and calculus has been removed off the tooth and the roots of the tooth. If it is determined that bone loss is still there and there hasn't been a great improvement in the periodontal condition, we go on to the second stage of treatment, of periodontal treatment, which is more of a surgical approach. And a surgical approach is actually flapping the gum and removing any granulation tissue that's underneath there, reforming the bone around there, and possibly even placing bone grafting material into that to restore the contour of the bone and the areas that have been resorbed due to the periodontal disease. As we can see here, that from this chart, that periodontal disease has been associated with other diseases, which is heart disease, diabetes, rheumatoid arthritis, and other various systemic diseases. And so it is very important that periodontal disease is treated so it can, if not prevent these other diseases, but cannot cause or be the cause of other diseases, or other diseases to have an effect on your gums by having a poor oral hygiene. So a lot of times patients will come to me with a note from their physician for a dental clearance. Dental clearance means I need to look in there to make sure that there is no active decay or infections in the mouth for them to proceed with their surgery. And that is something that is very, very important, because it is now common that physicians and dentists work together to make sure that there's no infections that can spread into the bloodstream and affect any organs of the body, heart and kidneys specifically. Thank you very much for watching this episode of Periodontal Disease. I'm Dr. George Emile, and I'll see you next time on taking care of your oral health.